Thank you. Let's see if I'm good with this, because I'm not very good at the technology, but obviously. Thank you for the invitation. Following Dr. Rosenberg talk, I'd like to give a brief overview of what is going on in Latin America and an account also of the response PAHO it's putting together for the 35 member states and several other territories in the Americas. Okay. Okay. Sorry. Technology, I'd say it. As you saw before, what we have here is the countries and territories of the Americas that has reported a Zika virus infection since May 2015. Officially confirmed laboratories started with Brazil. Just before, as mentioned, Easter Island reported the first couple of cases, 2014. It is traveling north. It is now almost everywhere, 26 countries and territories. And let me just start with Brazil, which was the first country to report in May confirmed detection of Zika virus. Nonetheless, in January 2015, already the states of Pernambuco, Bahia, and Paraíba in the northeast were seeing an increase of symptoms suggested of Zika virus, signs and symptoms of Zika virus in people like conjunctivitis, rash, and fever. So, and this is important for the correlation related to the potential link to microcephaly. Just in October, Colombia reported the first cases of Zika virus. And I must say Colombia has a very strong laboratory platform. It's following several pregnant women, hundreds, 2,000 pregnant women with Zika virus, and that will tell us a lot. But at the same time, Colombia report, as you can see, Zika virus, Brazil was already reporting in October an increase in microcephaly in children. Then, as of today, recapping, we have 26 countries and territories, and they are all here. We are hypothesizing that all the countries of Latin America and the Caribbean will be affected, probably except continental Chile and Canada, because of the presence of the mosquito in all these countries and the lack of immunity of many of the population. Of course, we're not saying these countries will have a massive outbreak or so. It has imported cases, and we don't think it will be an outbreak in the United States, but nonetheless, precautions has to be taken, and aggressive response has to be in place. As you saw, the mosquito is present in the south and in several other areas. This is the weekly epidemiological curve, epi-curve, of the 26 countries, and this is a little bit confounded with countries that are reporting only a few cases, but the bottom line here is that we haven't seen the peak of this outbreak in Latin America and the Caribbean. You see that 120,000 cases has been reported, but this has to be put in context because, as you know, laboratory diagnosis is not widely available. There is no commercially available test. The window of diagnosis is only probably 5 days. many people, as reported before, 1 in 4 only develop symptoms, so people usually don't go to the health services. Different to chikungunya and dengue fever, because they produce a huge, strong pain in the bones and the joints. But Zika is usually very mild disease. So we will be missing a lot of cases, no matter increasing and strengthening surveillance for Zika. At some point, several of these countries, because it's also important to qualify that this was not a reportable disease in many of these countries. Several countries actually, when they confirm the presence of Zika virus, they stop counting. Brazil was one of them because of the huge number of cases they were seeing. And now they came with estimates between 400 and 1.3 million cases of Zika virus in the country a few weeks ago. Colombia just recently said that they are expecting 500,000 cases of Zika virus. We cannot be surprised if we see 2 or 3 million cases of Zika virus in the Americas. Why is that? In 2015, there were 2.3 million cases of dengue fever reported in the Americas and 600,000 cases of chikungunya fever, suspected and confirmed. So it's the same mosquito, lack of immunity. So we haven't seen yet the peak of this. These are some of the symptoms and the clinical cases on the outbreak, and it can be easily confused with chikungunya and also with dengue fever. And I always advise clinicians when they ask me, I said, if you don't know what it is, think of dengue fever first, because this is the one that has high mortality, and at the end of the day, what we want is to protect life and to prevent people from dying from this. Here is the, what you have there in the left side is the rates of microcephaly in Brazil between 2010 and 2014 in violet dots, very small. And you see in the right side the rates of microcephaly in Brazil in 2015, 2016. Certainly an increase. And you all know that Brazil started using different definitions, 3 standard deviations or 2 standard deviations. But no matter what definition they use, the evidence suggests there is an increase in microcephaly. And they are now reviewing all the records of the affected children and going back to the mothers. And as you know, probably already in the media, they have confirmed several hundred cases of microcephaly, and still 3,000 or so are under investigation. There is a paper coming submitted by Brazil to the MMWR, presenting the ecological analysis or the correlation between the Zika and microcephaly. And this is the state of Pernambuco. As you can see in blue and the red line, microcephaly reports. And 9 months before, 8-9 months before, outbreak and rash and fever detected by the authorities, an increase I was mentioning. And then the first case of Zika confirmed in May. So the analysis has been done, and of course, we always said we cannot talk about causality because we all know correlation doesn't mean causality, and sometimes don't even mean association. So, but it is associated here, and similar exercise has been done for other states like Bahia and Paraíba. Brazil is now conducting a case control study that is going on. It is expected that probably in April we will have some more data to tell us about what is going on. A couple of cohort studies, one in women, pregnant women, and one in children with microcephaly. And Colombia is following about 2,000 women and probably more infected with. Now, let me refer to a little bit to Guillain-Barré syndrome. Where you see in the curve in yellow in the French Polynesia, it's the reported Zika viral cases. And there is a mistake because it should be red, but it came blue. In red, what we have is the GBS, or the Guillain-Barré syndrome in the French Polynesia. The issue is that, as per this curve, 4 weeks after the Zika epidemic started in French Polynesia, we started to see an increase in Guillain-Barré syndrome. And later on, newborn cases with neurological malformation. I think there were 17 cases reported that were looked at retrospectively. What we see here, it's the Colombia data showing that in blue, the Zika cases, 25,000 cases being reported cumulative. And what we see also in the bars is the Guillain-Barré syndrome or neurological syndromes. And it's about 4 to 5 weeks also that we see that Guillain-Barré is coming, is showing up. We are now in the process of working with our colleagues in WHO, modeling this epidemic, and if there is a link, finally, a cause effect Zika microcephaly, and it's not a modifier or effect modifier, but if there is a link, we should be expecting seeing microcephaly cases in Colombia around June, actually. So important, the need to follow up these cases. So what PAHO has done, I'm not going to go into details of the research. I think Dr. Rosenberg has mentioned very well some of the needs epidemiologically. We have put together a strategy that is based in 3 pillars: detect, prevent, and respond. Early detection of the virus, prevent risk reduction by mosquito control, and what we're recommending to the countries is an aggressive intersectorial and multisectorial vector control campaign, as is the only tool we have present. Several head of states in Latin America has come forward and are on top of this. But of course, because what we don't want is to have, another several hundred cases of microcephaly, regardless if it's the cause or not. And the advice is that we tell them, don't focus on the cause now. Let science to run its course. And we will know at some point if it's the cause or not. But it will be the same response, regardless if it's the cause or not. It's the mosquito. And by targeting the mosquito, we are targeting dengue, chikungunya, and Zika. We are coordinating with partners. In the Americans, we have 2 laboratories that are WHO collaborating centers. It's Canada and the United States CDC. We have extremely good relationship with the CDC. We talk on a daily basis with them. We are conducting several workshops to train our countries in terms of laboratory diagnosis. They have a lot of needs. We have been providing reagents, and we've been discussing with the USG agencies how to collaborate. I think they're here. And as of today, this week, there is a meeting in Puerto Rico of all WHO collaborating centers to discuss arboviral diagnostics and to try to come up with an arboviral strategy based on the dengue integrated management strategy, because at the end of the day, more than 200 arbovirals. The key issues for our member states is risk communication, to educate people, to pass information, facts to the people, and to women of reproductive age and to pregnant women. Several technical missions are on the way with partners through the Global Alert and Response Network of WHO. And an important thing to coordinate, we're calling also an expert consultation on Zika virus research in March 1st and 2nd. It was announced that NIH is calling another one. Institut Pasteur is calling another one in April or March. So a lot of going on about trying to find out what's going on with this, because there are a lot of questions we don't know that we need to know. In the meantime, countries need to strengthen surveillance of Zika, neurological malformations and birth defects, and we have a website that is available to everyone. I thank you for your time.